Learning unit number 4. In learning unit number 4, we're going to tie together the concepts of emotional intelligence and patient safety. So we know we spent Nursing 573, a full class on patient safety. So we have a great foundation on that content. So let's tie it together and let's look at advancing our education, what our decisions may be in the future. So in this learning unit, let's go over some of just the topic. So we're going to see how emotional intelligence can, according to our author, offer a novel approach for addressing the ongoing patient safety crisis in the U.S. We know that our healthcare culture has been one of denial and repression for both physicians and nurses, which has led to burnout. We also know that changing the culture can be very difficult, but it may have the biggest impact on improving patient safety. So while difficult, it can have the biggest impact. In addition, miscommunication and conflict between and amongst staff, patients, and families can result in medical errors. So enhancing the EI of all healthcare workers can have a significant impact on these cultural elements that undermine our patients' safety. So we're going to end by reviewing the CPPS Certified Professional in Patient Safety certification information and look at whether in the future we may want to pursue our PhD, EDD, or DMP, as well as other certifications. So we're going to read Chapter 13 on EI and patient safety in your text. It's a relatively short chapter, but it has some really good information that reviewing the discussion board post first may really help you focus in on what I want to assure that you come away with, what information that you come away with from Chapter 13. So you could have already read Chapter 13, or I do recommend that you look at what the discussion board is, and we'll go over that in a minute prior to reading, and that will help you. There's a video about EI turning medical challenges into opportunities. It's an interview podcast of a physician, a cardiac pediatrician about EI. You will have read an article, The Lessons of Patient Safety Mindfulness. Another really brief and older one. It was written in 26 about becoming certified in patient safety, a nurse's perspective. You're going to review, because in Nursing 573, you reviewed the information on that certification. So you're going to go back to that website and just give it one more time of thinking about yes or no. Is this one of the certifications that I want to look at taking in the future? I've already printed out or printed. I've saved the file. It's a one-page brochure about the CPPS. If you are interested, you might want to print that out or save that to your desktop so that you have that information to look at again. And then a minute, 30-second or whatever video from a nurse who has completed her certification. No reply is going to be required of the discussion board this week, but I do hope you are looking and reading and sharing in some way the posts of your fellow classmates. So this is a video. This is the one of the physician being interviewed in a podcast about EI. This is the article on patient safety mindfulness. Again, another very brief one. This is the short but sweet article that I think is really good to review. Now, if you know for sure you're not going to sit for a certification or don't want to sit for a certification as a CPPS, go ahead. Omit it, but maybe that's going to change your mind a little bit. This is the website that we've gone to in the past, and this is through the Institute of Healthcare Improvement. Remember, we have looked when we formed that course in this program, we did look at the blueprint of that certification exam to assure that you're being prepared for that. I do not say that you need to take the courses that are paid to prepare for it, but there are other resources too that you can use to best prepare to sit for that exam. Here's the brochure. You can access it by that link, but you might just want to click on there and review that. Here is the brief video of the nurse who has sat for certification, and the discussion board. So the discussion board brings us really back to those readings on culture from our author. And you can look through it. Please do. I want to keep this a little bit briefer. So our author talks about a Bermuda Triangle of medical errors. She talks about the Lone Ranger culture, and she also talks about the macho nursing culture. So these are all cultural issues that maybe we can address to enhance patient safety, enhance nursing well-being as well. So for this, after your readings of this week, you're going to be thinking about through the lens, through the perspective of a nurse leader or nursing leadership. And this is, what behaviors do you see in yourself or other nurse leaders that can be considered a safety breach? Now that's in quotes because, again, Cottier in chapter 13 talks about an example of an institution, a healthcare organization that considers certain behaviors safety breaches. So make sure you look back at that to understand what I'm talking about. And no reply is required. But again, take a few minutes to look through at least one or two of your peers' postings, because I know I learn from each and every one of you, and I hope you have time to do the same. Thank you and have a good week.